Hi, my name is Reagan Diamond, and I'm from the Exercise Science 486 class, and today I'm here to talk to you about muscular dystrophy. So to start, we'll define muscular dystrophy, and according to the National Institute of Neurological Diseases and Stroke, muscular dystrophy is defined as a group of more than 30 genetic diseases characterized by progressive muscle weakness and degeneration of skeletal muscles that control movement. So as this disease progresses, patients experience a great deal of muscle atrophy, which is also another way of saying muscle wasting. So the muscles and the cells and tissues of the muscles degenerate as they weaken, which just means they get smaller, they get weaker. And the word dystrophy itself comes from the combination of two Greek words, dys meaning abnormal or faulty, and trophy meaning food or nourishment. So this means that the nourishment of the muscle was defective, quite literally. So in the early history of the disease, they thought that it was all due to poor muscle nutrition, but they quickly realized that it was actually due to genetics. So now the term just is used to indicate or represent abnormal muscle wasting and weakness, which is what the disease is. And there are 9 different types of muscular dystrophy, including Duchenne, which is the most prevalent and what we'll be focusing on mostly today. Becker, myotonic, limb-girdle, fascio-scapulohumeral, congenital, oculopharyngeal, distal, and Emery-Dreifuss. And as I said, we'll be focusing mostly on Duchenne, which affects mainly the muscles of the limbs and the pelvic girdle. So the disease is fairly prevalent. Duchenne is the most common type of muscular dystrophy and actually the most fatal for children. And it is estimated that it is 1 in every 3,500 male births, and it usually sets at about 3 to 5 years old, with the symptoms intensifying around 6. And the disease affects nearly 250,000 people in the United States. Females are not typically affected, but we'll touch upon this more in the genetics discussion. So just to do an overview of genetics so that we're all on the same page, humans have 22 pairs of autosomes and 1 pair of sex chromosomes. They get 23 chromosomes from the father and 23 chromosomes from the mother, which is 23 pairs totaling 46 chromosomes total. Females have 2 X chromosomes. They get 1 from the mother and 1 from the father, and males have an X and a Y chromosome, the X coming from the mother and the Y coming from the father, which makes them male. So as far as muscular dystrophy goes, as I mentioned, all types are genetically inherited, and the gene that carries muscular dystrophy is an X-linked pattern, which means that the mutation is carried on the X chromosome, which is inherited mostly by the mother. Every son that is born to a woman with the dystrophin mutation on one of the X chromosomes has a 50% chance of inheriting the flawed gene, and every daughter has a 50% chance of inheriting the gene and becoming a carrier. So women are the carriers of muscular dystrophy, and they do not always show symptoms, but they do then have the ability to pass on the disease to their offspring. So Duchenne muscular dystrophy usually does run through a family, and it's pretty prevalent. However, it's definitely possible that an existed mutated gene can exist in females for generations, and no sons were born with it, so it can appear to come out of nowhere. However, women through generations have been carrying the mutation. And a woman can also have a sudden onset of mutation in her egg cells, but this is not nearly as common. So dystrophin itself is what causes the disease, the mutation of a dystrophin protein in a gene, and it is located mostly in the skeletal muscle and the cardiac muscle. And dystrophin has a job of connecting the intracellular actin to the sarcolemma, and by doing this, it stabilizes the muscle to make it stronger. It makes it a unit, and it just makes it overall strong. So if the dystrophin proteins are not working properly, then the unit can no longer be stable, which causes the calcium and creatine kinase to flow into the extracellular space, which causes a ton of damage to the muscles because they are usually kept in control. And the muscles are made out of muscle fibers, which you can see in this picture, and each individual bundle is surrounded by a membrane, which then makes up the entire muscle. So there are also many symptoms that are associated with this disease, some being frequent falls, a waddling gait, which is an abnormal walking pattern, walking on the toes, large calf muscles, muscle pain and stiffness, Learning disabilities can occur, and difficulty rising or lying from a lying or sitting position, which is known as the Gower's sign. So I have attached two videos. First, we'll start with the Gower's sign. So Gower's sign is commonly associated with the disease of muscular dystrophy, and as you can see, he's using his hands to walk up his body to help him stand up because his muscles are not strong enough. And we'll also watch a video of the waddling gait, which is an abnormal walking pattern. And as you can see in this video, this young girl is sort of waddling rather than walking with her two legs one at a time. And this is caused by weakness in the pelvic girdle. So there's also even more symptoms, which is eventually needing a wheelchair. Most patients become wheelchair bound midway through their lives, usually in their teens, since their life expectancy is so short, and this decreases their independence and mobility. And there's also shortening of the muscles or tendons around joints, which is also known as the contractures. And there's also breathing problems or lung failure. And a huge one is most patients suffer with cardiomyopathy, which means it's harder for the heart to pump blood, which eventually then leads to heart failure. And last but not least, many patients are eventually diagnosed with scoliosis because their muscles become so weak that they can no longer hold the spine up properly. And as you can see in this picture, 2 years, 8 years, and 15 years, these symptoms progress fairly quickly. So there's multiple different ways to diagnose Duchenne muscular dystrophy. And to start with the CPK test, which is also known as a creatine kinase test, doctors take a small blood sample from the elbow or the heel and test the levels of creatine kinase. In normal, healthy people, these levels are usually about 100 to 200 units. And in someone with Duchenne muscular dystrophy, these levels would be 50 to 100 times that, since the creatine kinase is leaking out of the muscle cells. And we can also use a DNA test, which blood samples are then taken, and the doctors look for genetic markers on the leukocytes or the white blood cells. And there's also an electromyography test, which they test the amount of electricity generated when the muscles contract, and the action potentials can actually help determine if a patient has Duchenne muscular dystrophy. They also use muscle biopsies, which is when they extract a small piece of affected muscle and examine it. And they also can then do a muscle histology, where they extract a small piece of the affected muscle and examine it under a microscope to look at the muscle fiber patterns. So it is very important to note that there is no cure for Duchenne muscular dystrophy, but there are treatments to improve quality of life and possibly slow the progression of symptoms, because once they start, they progress fairly quickly. So research proves that the use of corticosteroids can help to decrease inflammation and can potentially heal some weakened muscle cells. However, there are definitely long-term effects that come with taking these steroids. They include high blood pressure and behavior changes. Most patients also receive occupational and physical therapy, which they do this to maintain and increase their range of motion, and it helps to keep the joints as flexible as possible. Most patients are also given braces to help keep the muscles and tendons stretched and give them support. And there's also breathing assistance for when patients develop the breathing issues later in their diagnosis, so they can be given sleep apnea machines or ventilators to assist with their breathing. And there's also surgical procedures, but this is mostly just to cure the scoliosis that some patients get. There's also current research being done on gene therapy, more surgical options, drug therapy, and cell therapy, so hopefully there's more of a cure on the horizon. I also found this all-encompassing treatment method that includes exercise, which is very important, and it's called the 3 Ps. So the 3 Ps stand for promotion and maintenance of good health, prevention of deformities, and preservation of respiratory functions. So I'm going to focus mostly on the promotion and maintenance of good health in general, because with this disease, the patient's quality of life tends to deteriorate quickly, and we can somewhat prevent that with promotion of good health, whether that be good diet, exercise, you name it. So vigorous exercise is not recommended, but light to moderate exercises can have an extremely beneficial physiological effect. Swimming especially is recommended as a form of aerobic exercise because the buoyancy of the water makes exercises easier to perform and takes a lot of pressure off of the muscles and joints. So swimming can give people with Duchenne a chance to increase their aerobic capacities and their strength without putting pressure and stress on the body. It's also proven to help mental health because participants are able to complete more tasks in the water since they're not stressed, and it is also a feeling of refreshment and relaxation, which improves mental health. So overall, swimming and exercise in general help to improve a patient's quality of life, and it can also prolong some symptoms. So when it comes to exercise and muscular dystrophy, it is important to always be cleared by a physician first for many reasons, but especially since muscular dystrophy is so highly correlated with heart problems, specifically cardiomyopathy. And once cleared, light exercise can be extremely beneficial, as I said. And it is critical that these patients are properly performing exercises because tearing or straining a muscle can be extremely detrimental because they already have the weakened muscles and atrophied muscles. So a muscle injury will only tend to have them degenerate more. And some implications for exercise for people with muscular dystrophy include chest pain, shortness of breath, nausea, and muscle injuries. So it's very important to kind of keep tabs on how they're feeling as they're exercising so that nothing happens. So for my case study, my patient John came to me. He is a 10-year-old male diagnosed with Duchenne muscular dystrophy. He is 4 feet and 6 inches with a weight of 90 pounds. This makes his BMI 21.7, which is slightly overweight for his age. He is struggling with progressive muscle weakness and impairment. John has no history of chest pain, muscle spasms, or an irregular heartbeat. He is not yet wheelchair bound and would like to prolong his ability to walk and be independent, even though he has recently been struggling. After John was diagnosed with Duchenne muscular dystrophy, he became very inactive because he only heard about the negatives of his diagnosis. He started having an extremely negative outlook on life, and he wants to start exercising to improve his mood, lose some weight, and prolong his ability to walk and be independent. So I came up with an exercise prescription to help John meet his goals, and I used the FIT principle to construct this appropriate regimen. FIT principle stands for frequency, intensity, time, and type. And he also completed a 6-minute walk test. I won't be pushing him anywhere near his maximum, but I just wanted to test some baseline levels to make sure that he could be safe. So John should be completing sessions of aerobic exercise 3 to 4 times a week, preferably non-consecutive. He will be performing light exercise at about a 6 to 13 on the RPE scale, which stands for rate of perceived exertion. He will exercise for 30 minutes so that he's not pushed too hard, and I recommend swimming because of all of the benefits that I mentioned earlier that it has for muscular dystrophy. And for resistance training, John should be doing this 2 to 3 days, again, hopefully non-consecutively. He'll be performing a light resistance training at about a 6 to 13 on the RPE scale, and he will do 2 sets of 10 to 12 reps per set. I recommend taking a minute rest between each set so that he can also do a combination of free weights and machines, depending on what he's working that day, depending on what he's interested in. And he will also be doing flexibility training, which is extremely important as it can help with contractures. And he will stretch a minimum of 5 days a week, but ideally every day. Stretching is considered a light exercise, but it should be done to the point of slight discomfort. And they should be held around 15 seconds per stretch. And he will be doing a combination of both passive and active stretches. And these are my references.